Join us for an instructor-led tutorial on how to perform high frequency.
Okay, so, and when you plug this in, always make sure that this indentation is facing, if you're on that, this indentation's gotta be facing me. If you're on this, it needs to be on top, right? So on that, it's gotta be facing me. On these portable ones, it's gotta be on top. And then I line it up in here. I'm sorry. Well, maybe. Yeah, there. So it needed to be on top. Then what you do, you make sure that this is on. Oh, before I turn on. For penetration of product, because that's the whole idea what I'm doing right now. After that mask, I'm putting on my serum, and I'm gonna penetrate to the skin. For penetration of product, you use this rod or this little ballpoint or whatever, or this one that looks like a little spoon. Okay, these are for penetrating product. What color? Just throwing this out there. What color do you think the lights are on these?
Red.
Red or pink? Okay, I don't want to confuse, because the other one could be red too. But it's more, no, I'm sorry, no, it can't. It can be seen as red or pink or orange. They come out looking like that, red, pink, or orange, brighter color. So, what I do with these, let's just use this one first. I'm gonna put this in, right in there, I'm gonna set it aside. What I want to do is get a dry, the gauze over there. I'm gonna show you, then I'm gonna show you on someone. Okay, so I'm gonna get the dry gauze, the mask, and then I'm gonna put the serum on her, okay? Hello. So let's do, niacinamide would be for acne. Now, and that, if I were doing someone that I did extractions on, and at the end of the facial, that's the one I would use, okay? And then Power Bright would be to brighten the skin, to make a pretty glow on the skin. It could be for someone that maybe was more on the anti-aging side, or maybe that wasn't even that old and had duller complexion and needed a little lift in their shine, right? Okay? And then there's hyaluronic acid. This can actually be for everyone, but it would be especially for the drier or dehydrated client, okay? You could even use a little hyaluronic acid on acne, because usually people that have acne are using products even if they bought at the drugstore or they bought from me, who knows? Because what it does, it dries everything up and it dehydrates you, it can, okay? So even professional product. So use your best judgment at the end of the facial on an acne client, which serum you want to use. You,
Like if you spot.
you're gonna be told different things, but I'm gonna tell you, yeah, but I would spot treat it.
Yeah.
I wouldn't do one and then put one all over. The reason why, let's take that, let's work at it like it's an acne client. We did extractions, we did scaling gel first to soften the extraction, and I'll show you how to do this in here in a second. And then we did extractions, and then we did the post-extraction solution. I could, before the mask maybe, put a few, a little drop on where the breakouts are, and then let that dry for like a minute, 30 seconds, and then put the mask over top and let it sit under the mask. If we're acne, I could do that. And then at the end of the facial, before I put moisturizer on, I could use hyaluronic acid, wherever that is. Does that make sense? Okay. So right now we just did all those extractions. I put this under the mask. You don't have to do that, but you can, okay? Also, or I could just use it, not do it at all, and use this at the end. It just depends on how dehydrated they are. Does that make sense? Okay, so let's pretend. I chose this one, niacinamide. I don't want to massage it too much because I don't want it to end up more on me than the client. So what I do is I pat it first where I want it, you know, and or I can do it. I'm doing it all over right now. And then you may want to rub it in a little if it's too oily looking, you know. Then the skin has just been masked. We just had a mask on. We took off the mask, so I'm getting ready to, I put that on her. Then I'm gonna get a dry gauze, okay, the cheesecloth, okay? Open it up. I'm gonna put this over my client's face, okay? And I usually make sure it's as spread out all over evenly as possible. And then I'm just gonna tap this down. Not gonna massage it, just tap it down so it's all over skin. Then I'm gonna turn, make sure the machine's on, or this is on, or that's on, whatever you're using. But okay, this won't do much on this because it's not human skin, but I'm gonna show you how to do it. So I got this all hooked up. We saw that. Okay, so this is what's it called? This is high frequency. But what's this knob called?
Oh, the rheostat.
Rheostat. So what's rheostat do? It turns up the volume. Yeah. The amperage. And amp means what? Power, strength. Exactly. Okay. Okay. So let me see from here. I can't see. So let's say I want you to, I'll turn it up pretty high so you can see the color. So I got it up like this. The first thing I'm going to do is ground it. Up high. Okay, I'm gonna ground it, then I'm gonna put my hand on the client, and then I'm gonna take this, and with a cheesecloth, you can even touch the gauze, okay? Because if I didn't have the cheesecloth, I'd have to keep it like this. Like where I'm just brushing over the skin, not really touching the skin, but it's getting it as close as I can to the skin. The reason why for this current, what kind of current is in here, do you remember?
Direct.
The whole, everything we're doing is done through galvanic current, but this, the high frequency current is called Tesla. Yeah. So, in order for any Tesla current or the galvanic current, whatever, it has to have I call it a whole ozone. Yeah, it's an ozone layer. It doesn't work if it touches your skin, so there's gotta be a thin ozone layer there, okay? So that's why if you have the gauze on, you can touch the gauze because that's all it needs. It just needs a little separation. But if you don't have the gauze, remember to ground it, lift it, and get it as close as you can without touching. Now they say when it touches the skin, it can shock someone, and it can. But believe me, I've had it touch my skin many times, and it's never been so bad that I'm like, oh my God, but it gives you a little shock, okay? Just keep that in mind. The higher the amperage is, the more shocking it'll be, of course. But you do that everywhere. If you make sure you get over the nose and the crease, and if you're doing the cheeks, kind of lay it to the side. So, because if you just point it, it's not gonna go. Does that make sense? But you are gonna point it if you want to do it like up here and delicate, hard to reach areas. Okay. Now, that is that one. That penetrates product. Here, this one is made to get some more finer, not sensitive, but smaller areas, harder to reach areas. Bless you. Thank you. So it's the same thing. It's orange. Okay. So once again, I'm putting the gauze on, and the gauze is dry. It's going to get confusing, and you'll understand what I'm saying. With high frequency, the gauze is dry. Okay. So, and then this one I could do between the lip and the nose, around the lip, around the eye, harder to reach places. Okay. Could I do it all over? I could if this is all I had, but it probably wouldn't penetrate as well as something that can go directly. Yeah. Okay. Then these both penetrate, and then this one penetrates as well. It's the spoon. So once again, I'm going to ground it, and I'm going to run it over her skin. Okay. And do it all over her skin. Is there any real way to do it for high frequency? There probably is somewhere out there they tell you, but I'm gonna just be honest with you right now. I just want you to practice using it and getting as close to your skin as you can, or on the gauze you can get in the habit of gliding on over it. I usually do one side, the other side. I go back and do one side, the other side. Then let's say we're using acne. Okay, she's got hormonal breakouts here. So I did it all over twice. The third pass, I go and just do the area that I need high concentration on, like the acne areas. Does that make sense? Okay. So same with all three of these. These are the same things. They just are different shape to get different places. You see that's purple? I have no clue. See that purple? Okay. This one's a purple lavender color. This one's used for extraction, or this one's used to help kill bacteria. It's germicidal. Best time to use it is after you've done extractions, or if you have just done an exfoliation and you just want to clean up any bacteria that's built in the pores. That would be a good time to use it. Okay. You could use it too before you put moisturizer on, but you just infuse serum in there. I would put my gauze on her and I would go about that close. I wouldn't go any closer. Have people done it? Yeah. Has it shocked them? Not always, but sometimes it does. So it's better to be safe than sorry. So go as close as you're comfortable with, So up here, I could probably work a little under around the eye. I wouldn't even go under the mouth. That's too risky because it's right there. But I would go as close as I could, like really about that close. Sorry. On the other side, it's fine. It's just those piercings don't cause a lot of reaction, but they have been known to, so you just want to, not get real close. Thank you. Good question. Okay, the one way is to infuse product. What light do I look for in my electrode if I want to infuse product? Orange, pink, red. Yeah, we all see it differently, but I've seen all three colors. Okay, so orange, pink, red light. That's the one for penetration. There's 3 prongs to choose from. Okay, and what current is that machine ran on? It's direct. And what's the name for it? Galvanic. Okay, this machine is just high frequency. It has to be plugged into the wall, so it has there's a little galvanic that goes to work there. But when it gets up to this part, it's not. What current is it? It's Tesla. It's the cord that makes the difference. Sometimes it's on that. Yeah, let's just stay there. Okay, so this is Tesla current. Okay, Tesla current, is it alternating or direct? Alternating. Okay, that's a future test. That's why I'm pushing you now. Okay, when do you use high frequency in a facial? When do we apply the serum? Okay, after the mask, put the serum on, and then what do I do? Good, that's very important. Put a dry gauze on the face, make sure and remember, we're just patting the serum down all over it. We're putting it all over. And pat the serum down, and then put the dry gauze over top. And then I go to my choice. I'm going to do it on you guys, your faces. Okay, good. Yeah, look, watch. Here, do it on me again. And watch the... See that? That's kind of cool. Thank you. And the reason I wasn't there, I'm like, take your hand off there. God, you're a funny one. Megan, that's what you should win. Ah! Gosh, she's so funny.